You wake up, reach for your alarm, and feel a sharp twinge in your shoulder. It's easy to assume you slept on it wrong or pushed too hard at the gym, a simple muscle strain that just needs time to heal. But if you want to check what's actually happening inside that joint, there is a 30-second diagnostic test you can perform right now to see if the issue is a structural blockage. Try these 3 movements. Lift your arms straight up to touch your ear. Next, bend your arm outward at a 90-degree angle, like an L shape. Finally, reach behind your back toward your opposite shoulder blade. If you hit a physical roadblock on 2 out of these 3, you are likely looking at more than a pulled muscle. A strain involves frayed muscle fibers that hurt when you move them, but the joint itself remains mobile. In adhesive capsulitis, or frozen shoulder, the gray capsule surrounding the joint physically constricts. At this point, the bone is mechanically blocked from rotating, even if someone else tries to lift the arm for you. Failing these tests indicates the joint capsule has adhered to itself. Waiting for the pain to pass with rest neglects the fact that the joint is being physically held shut by internal scarring. This leads to an obvious question. If there was no car crash, no fall, and no physical trauma, what caused the joint to spontaneously cement itself together? The common name 50-year-old shoulder suggests that this is just a natural consequence of aging, an inevitable breakdown of the body that we have to accept. But accepting that myth often leads to permanent loss of mobility. To understand why a healthy joint would lock up, we have to look past the shoulder and toward the body's internal chemistry. While the pain is localized in the shoulder, the triggers for this condition often circulate through the entire bloodstream. When there is no clear injury, doctors classify the condition as primary frozen shoulder. While it is often labeled as idiopathic or of unknown cause, modern research shows a high correlation between joint adhesion and metabolic health. Patients with frozen shoulder frequently have metabolic syndrome markers. High blood sugar, thyroid imbalances, and menopause hormone drops are linked to systemic joint inflammation. This persistent inflammatory state causes chemical irritation in the joint lining to manifest as physical scarring. When a shoulder freezes without an obvious injury, it often serves as a localized signal of a broader metabolic imbalance occurring throughout the body. This process unfolds in 3 distinct stages. Stage 1 is the pain stage. Relentless inflammation makes the arm hurt even at rest. Because movement causes a sharp sting, most people instinctively stop using the arm, accelerating the problem. As sharp pain dulls, you enter stage 2, the freezing stage. Inside the joint, fibrous adhesions grow and crisscross, shrinking the capsule tightly around the bone. Without movement, these pliable webs harden into rigid scar tissue, physically cementing the joint. Finally, there is stage 3, the thaw. While mobility may slowly return, up to 50% of people are left with permanent adhesions. These hidden, glued spots cause the joint to grind unevenly, wearing away the cartilage over the following decade. Misunderstanding this biological cycle is the primary reason why so many people suffer through years of chronic stiffness and eventual joint degeneration. Treatment timing is essential. Aggressive stretching during the inflammation of stage 1 can irritate the joint further, while complete rest during the scarring of stage 2 allows the adhesions to thicken and dry. The first priority in stage 1 is lowering the inflammatory markers. This often requires targeted medications or injections to calm the chemical irritation before physical rehabilitation can even begin. In stage 2, the goal shifts to mechanical release. Along with specific exercises, medical procedures like joint capsule expansion use pressurized fluid to physically expand the shrunken space and snap the rigid fibrous webs apart. Recovery depends on matching the specific physical intervention to the exact biological stage the joint is currently in. However, clearing the scar tissue in the shoulder doesn't address the metabolic environment that allowed the scarring to occur. A dietary thaw is often necessary to stabilize blood sugar and lower the body's baseline inflammation, preventing the cycle from starting in the other shoulder. This involves a focus on anti-inflammatory nutrition, like the 2-1-1 plate ratio. Half the plate is dedicated to dark green vegetables like spinach and broccoli, with a quarter dedicated to omega-3 rich proteins like salmon or mackerel. This shift helps provide the raw materials the body needs for healthy joint repair. Joint adhesion is often the first visible symptom of a body struggling to manage internal inflammation. Addressing these metabolic markers early is the most effective way to protect the longevity of your joints.